Rotator cuff muscles. The rotator cuff muscles, supraspinatus, infraspinatus, subscapularis, and teres minor, connect the scapula and humerus to help rotate and abduct the arm. These muscles form a common tendon around the shoulder joint. Torn supraspinatus tendon. Torn rotator cuff is a musculoskeletal injury that results from damage to the rotator cuff muscles or tendons. The rotator cuff can be damaged by overuse or disease. Direct trauma can cause the tear or rupture of a tendon, most commonly in the supraspinatus tendon. Patients with a torn rotator cuff often experience pain or weakness in the affected shoulder and have difficulty raising the affected arm above their head. A torn rotator cuff may be treated with medication, physical therapy, or surgery. Arthroscopic rotator cuff repair. Rotator cuff repairs are most commonly done with minimally invasive arthroscopic surgery. During the surgery, the torn supraspinatus tendon will be reattached back to the humerus. During an arthroscopic rotator cuff repair, a small camera called an arthroscope is inserted into the shoulder joint. The camera displays pictures on a screen, which the surgeon uses to guide the surgical instruments inserted in the additional ports. 3 ports are placed in the standard positions to begin. Times posterior, times anterior, times midlateral. Bone preparation. The humerus bone is prepared for suture attachment under camera supervision. A threaded dilator makes an opening in the humerus for the suture. Times supraspinatus tendon sutured. Times the sutures are passed into the humerus and the supraspinatus tendon. Times sutures tightened. Times the suture knot is tightened to connect the torn end of the supraspinatus tendon and humerus. Rotator cuff repaired. The sutures are tightened to complete the connection and repair the tendon's function.